You're listening to The Revolution of Regenerative Medicine, a podcast with me, Dr. Gregory Laurence. So Wayne, you're my Krav Maga guy at age 70, whatever, and you could probably wrestle me down even though you're 20 years older than me. But so it looked like you had a question.
Well, I do have a question. First, though, I'd like to just make a couple of comments. And I am a Krav Maga guy still, by the way. I got my third belt.
Wow.
Yeah, the thing I want to say is, my issue is heart, and the fascinating thing to me about I asked this scientist one time, a good friend of mine. He lives in Nashville, and I asked him about I'd had the heart attack, taking care of my wife. She had ALS, and I went through about 4 years of intensive caregiving work, and so I just couldn't take care of myself. So one day I had a heart attack, and it was probably mainly stress related. But I had a massive heart attack, and the thing is, I was an athlete, so most of my heart was really great. And so I asked this scientist one day, a friend of mine, I said, "How can I get that heart healed?" And he said, "Wayne," he said, and I had asked him, I said, "Can't you extract stem cells and somehow inject them into the heart or do something like that?" And he said yes. He said, "Thing is about a heart attack is the heart pulls after you have an injury. The heart begins to pull stem cells, from the bone marrow, okay, and it starts to fix whatever's wrong." And he says, if it did it long enough, it will completely heal your heart. And I thought that was fascinating. It was it only does it like a week or two, and it kind of, band-aids it over. But if it went on for a while, it would you'd literally have a new heart.
Well, you're the type of guy that would have known the right question to ask, and I'll tell you another part of that that's going to be not only exciting for you, but I think Ione as well, who is really close to being on the transplant list, and that is that I am right now, right this second, emailing you and Ione and Greg and George a study that my wife found online like the last 24 hours, and that study is in the British newspapers, and they're quoting one of their prominent cardiologists as saying that they have just made a discovery which is just as great as transplant for hearts 30 years ago. And what it is they have you couldn't tell from the article whether they were human engineered cells that were put into a mouse or mouse engineered stem cells that were put into a human, but they had an incredible discovery on the heart being able to heal itself in a way that they had not been able to do. I've got colleagues, this isn't what I believe, I don't have the experience to say this, but I have colleagues that believe that they are already having those same results in the US without using mouse cells and without having to wait until they finish with those trials. Because it's your own body, it's something that can be done right now. So I have no doubt that we're going to be able to have engineered cells that will do some customized things down the road, but they may or may not be able to outperform what we can already do. We just have to get their protocols better, get the doses better. There'll be some expansions of cell lines in your own cells that you can get back, and we just are in the infancy of this.
Okay, that wasn't even my question. The question I have is stem cells are fairly heavy, so when you inject them into your system, do they continually circulate until they do their job, or can they be heavy enough that they lodge in one of the organs, maybe the liver or something?
So it's a great question. The first place they go is to the right side of your heart, and then they go through the lungs, which is the circulation in the blood, right? Peripheral blood goes to the right side of the heart, goes to the lung, goes to the left side of the heart, and then goes to your body. So they tend to lodge in the lungs, which is a really great thing if you've got pulmonary disease, because there's a lot of cells there, and we think that they tend to be more sticky if the body is in an area where it's trying to heal itself. And the way it heals itself is by simply sending out messengers. Some of these messengers are actually little pieces of RNA, and that little RNA codes what that tissue wants these pluripotent mesenchymal cells to become. And so we don't know exactly how they become adherent or how they go where they need to go, but they do tend to stay in the lung for a little while before they go everywhere else. However, it's also true there's several conditions in which there's almost overnight improvement in symptoms that are non-pulmonary. We don't understand why COPD, which is, I don't know if you guys have ever known anybody that had emphysema or COPD, but it's a terrible thing. You use inhalers to kind of help with the way the airways collapse. No cure, no treatment really at all, just something to kind of make the symptoms a little bit less. It just continues to deteriorate. We don't understand why, but these stromal vascular cell surgery procedures give these lung patients almost an immediate improvement in their pulmonary function, almost before there's even been time for the cells to have been able to grow. So we just don't really understand that, but it does happen, and it's one of the really, really exciting areas is for people that have COPD. So, Ione, I know that you were listening to that heart conversation intently because your heart is the big thing for you. Mm-hmm. You're somebody that I'm going to want help with. It may be that we'll get a competent cardiologist who knows about cell surgery that will say, listen, we've got some protocols that we can put you in, but you can do your first treatment just as a straight up, as long as Dr. Laurence can find 60 C's of fat somewhere on you. And I'm not sure if you've got that. You look like you're in really great shape. But if we can find that amount of adipose, you can have a treatment done. And I think that the data has suggested it's been represented by some of my colleagues, that it's pretty common for their heart patients not to require a multitude of treatments. They will get significant improvement with a single treatment. So if you are one of those outliers who has a better than expected result, you may not have to go through a series of treatments. The numbers of cells, and I should just explain and just kind of paint a picture in your mind. I told you earlier that 85% of the mass is lipid cells or adipose cells, fat cells, but 85% of the cells are actually non-lipid cells as far as numbers go. So we get a large number of those cells, and they are extremely viable. We use flow cytometry to tell what percentage of them are mesenchymal cells, which can become anything. But we also think the pericytes, which are around little capillaries, are important. Epithelial cells are important. Monocytes are important. Macrophages, lymphocytes, all these are really, really important. Fibroblasts, these are all important cells, and they all work together. And again, if you just Google stromal vascular fraction electron microscopy, you will see some incredible pictures showing all these connections between these cells. And so we don't think the magic really isn't just in one cell. We don't think the magic is in the fact that if your heart's trying to heal itself, it's going to find, remember, they're so unplentiful that we didn't even know they were there. There have been experts that have been claiming for years, for instance, that your heart didn't have any cells in it that could become new heart cells or new muscle cells. We didn't think that happened in the brain either. So we think that this cell surgery is helping the process along, and whether it also recruits things that are already natively in the tissue, or whether it just sees those messages coming out and it goes where it needs to go, it really seems to be that the vast majority of conditions respond so much better if there includes an intravenous component, even if you're also doing a directed component. So in somebody like you that's already gone through something that wasn't the easiest thing to go through, the harvesting of the bone marrow is not a simple, easy thing. A lot of times it's painful, a lot of times you have to do it under general anesthesia. The deployment of the stem cells was not a simple thing. Because liposuction is such an easy thing for me to do, I can, without any pain on a patient, harvest the amount of fat cells that I need, do the proper amount of processing. And I might want to mention, there are several FDA-approved processes that we use to take these stem cells from their native structure and change them and be able to get the stem cells out. Some of them are mechanical, some of the processes use ultrasound energy, some of the processes use enzymatic dissolving of the fat, but it doesn't really probably matter that much right now. Later it may matter once we kind of figure out better protocols. But the ability for us to be able to do a treatment like that for you is going to be so much simpler than what you went through before. And I think that some of my colleagues have already represented that their data with adipose-derived compared to bone marrow, intravenous compared to deploying directly into the heart is so much better that you potentially have the ability to do something that will right off have a result that you unfortunately did not get to enjoy when you were in the I don't know if you know yet whether you were in the placebo or whether you were in the treatment arm of that blinded trial, but you may have a much higher chance just because this technology among some of my colleagues has been demonstrated to be better.
Mm-hmm. I was very fortunate. I had a heart attack, 16 hours, was dragged off an airplane in Minneapolis, and got to be the very first person in a stem cell research where they harvested cells from my hips and placed them in my heart within 1 week of the heart attack after putting in 5 stem cells, or 5 stents, I apologize. They said I would live 2 to 4 years. I have already passed that up. Did I get the stem cells? Didn't I get the stem cells? It's still a controversy. But I'm still here, so I probably did.
So it would be a normal thing in a study in which the investigators and the patients were blinded, called double-blinded, randomized, for you to know at the conclusion of the study. Has the study concluded? The study concluded.
It was a 3-year study, and it took another year for me to find out whether I had placebos or not placebos. And there is actually some controversy on that because I was told that I had placebos. I was told that actually all the way through the study, but please stay with it because we need the comparison group. And then when I was asking for the stem cells, because I was told that they would be held for 10 years for me cryogenically, all of a sudden it was like, what stem cells? And then, no, we don't have them, you have them. Okay, so do I have them or don't I have them? I don't really know, but I do know that I'm still alive, way past when they said I should be.
Well, and that's the job of the institutional review boards that are throughout the country to determine whether a trial is ethical or not. And we definitely believe that in some cases having a placebo wing is appropriate. Once something has been proven to a certain level, then all of a sudden it becomes unethical. And I almost think that we're at a point right now where the efficacy of adipose-derived cells and extravascular components that are in the stromal vascular fraction are so effective in the hands of our colleagues that I would never feel right about a family member enrolling in a trial that had a placebo arm, because you would know right off the bat that something that is potentially effective and not dangerous. See, that's the other thing about a placebo-controlled trial. You're trying to look at you're looking at danger too. So it's possible that if you're in the treatment arm, you get efficacy, but it's also possible that there's danger. Well, we've now, in my mind, have demonstrated beyond a shadow of a doubt that there is nothing negative. You know, the only thing that could be negative is insurance wouldn't cover it, which is definitely the current state, and that you would pay for the treatment and you'd be one of the people who didn't have any result at all. But at least we're not doing any harm to the patient. So Anyway, so your story is as intriguing as I thought it would be. I didn't know some of those details, but definitely if you have any other information about that, like even weeks or months from now, I want to know, because that's great. Thank you for listening to this episode. Be sure to subscribe to my podcast, The Revolution of Regenerative Medicine. I'm Dr. Gregory Laurence, and I look forward to you joining me again soon.